Hi, I'm Bill Faulkner. On behalf of the ISMRT, I'd like to welcome you to the fifth and final video in our MR Safety Week Checkup video series. We hope you found these videos to be useful in evaluating the safety practices at your facility. In this video, we're going to look at medical emergencies in Zone 4 and issues relating to a quench. Now, medical emergencies can occur for many reasons. It seems we sometimes forget that we're administering a medical procedure to patients. And patients often have underlying medical conditions that can result in the need for emergent medical treatment. The administration of a gadolinium-based contrast agent, which is a drug, can trigger some types of adverse events. We simply must be observant with regards to our patient's condition and be prepared to act. This is a major reason why we must maintain visual and verbal contact with our patients. And if they are in a condition such that they can't respond, we must use some type of physiologic monitoring. The ACR guidelines state that MR facilities providing care to patients who require clinical support during the MR examination should have emergency response equipment and personnel trained in MR safety issues, as well as trained to respond to anticipatable adverse events, readily available to respond to patient adverse events or distress in the MR arena. So this is a good week to check and make sure that you have current policies and procedures in place which address dealing with medical emergencies in the MRI environment, specifically Zone 4. Is everyone who works in MR familiar with these policies and procedures? Are they required reading? Is the staff required to review these policies and procedures on a regular basis? If not, then perhaps they should. With regards to contrast media administration, do you have current policies and procedures that address, among other things, who can inject and when? Now, based on your country, do you have requirements with regard to physician coverage? If the technologist, radiographer, or other MR personnel may administer a gadolinium-based contrast agent, is there formal training in place? Even if the technologist or radiographer does not administer the contrast media, is there a formal and documented education program which addresses recognizing and managing adverse events? We sometimes forget the fact that a gadolinium-based contrast agent is a drug, and when you inject anything into a patient, an adverse event can occur. In this paper, the authors state that moderate and severe reactions that require immediate management do occur. We should all know that you simply cannot run a code in the scan room in Zone 4. Policies and procedures must be in place to address removing a patient from Zone 4 to a prospectively identified location where full resuscitative efforts can occur. Due to known dangers associated with a quench, quenching the magnet in the event of a medical emergency is not a viable option. In the event a code is called, support personnel will quickly descend on the MRI department and their focus is going to be on the patient. Therefore, Zone 3 and Zone 4 restrictions must be maintained during resuscitation and other emergent situations for the protection of all involved. It is critical to practice the emergent removal of a patient from Zone 4 at least annually. This should be required of all Level 2 MR personnel. Additionally, this should be practiced in all possible staffing scenarios. If you haven't done this lately, perhaps this week is a good time to do so. Other emergent situations include projectile incidents and a quench for superconducting systems, of course. When a projectile incident or near incident occurs, we need to look at the root cause of the incident and alter policies and procedures to prevent a reoccurrence. All incidents or near incidents should be reported to your MR medical director, MR safety officer, or management personnel as defined by your facility's organizational structure. Don't be afraid to be self-critical when an incident or near incident occurs. In order to create and maintain a safe MRI environment, it's important to find the root cause of an incident and just fix it. With regard to a quench, you need to have policies and procedures in place that address who can quench and under what circumstances. I have performed MR safety audits at sites where not all of the technologists knew the location of the quench button, nor were they familiar with their own policies relating to the quench itself. The quench pipes or ductwork should be inspected annually to ensure that they are sound and that they are not obstructed. Also check to ensure that the portion of the pipe that is external to the facility is clearly labeled as that being a dangerous area and that access in and around that pipe is restricted. And that brings us to the end of this video and this video series. I want to remind you of the resources that are available through the SMRT. These resources include video and text-based educational material with a greater amount of material available free to SMRT members only. Don't forget about the free safety posters. These can provide MR personnel with constant reminders of MR safe practices. And lastly, during MR Safety Week, it's important to remember that we, as MR technologists and radiographers, have a responsibility to our patients and other staff members to do all we can to constantly provide MR services in a safe and professional manner so that an incident such as the one which claimed the life of Michael Colombini does not ever occur again. So on behalf of the SMRT, I want to thank you again for taking the time to watch this and the other videos. We hope you're going to find the information useful. So until next time, this is Bill Faulkner. Thanks again, and take care.